Welcome.
Morning, everybody.
Hi
Thank you for,
everyone, good morning.
while we're waiting for people to join, I'd love for everyone to share where they're coming from. We're in California at the moment. There's the chat. Just type it in chat. I'd love to hear. Netherlands, nice. Oh, someone else from California. Cool.
Hmm.
Michigan. It's pretty cold out there. West Coast Canada. Indianapolis. Nice. Cool. We'll get started in like about a minute. I'm from Georgia. All right, I think we can get started and then people will trickle in and we'll just admit them as they join. Welcome,
Stand by.
everyone. Thank you for joining us today for our webinar. We're going to be talking about how to prepare and plan in advance for conception and pregnancy. And we're all, me and Alexander and Anu and Ash, we're all working on a company called Ferta. We help men and women heal and restore their fertility using natural approaches. So we integrate the best of functional, integrative, conventional medicine to create a plan for men and women to heal their fertility so that they can conceive. Fundamentally, we have a philosophy around infertility, and we believe infertility is a metabolic disorder. And so we look at the root cause to help men and women heal their fertility rather than coming up with more mechanistic solutions like IVF, which is great. It works in certain cases, but we think healing the body as a whole is a much more sustainable solution for people and leads to better outcomes. So that's what we do. And today we're going to be, like I said, talking about why it's important to plan for pregnancy, not just when you're ready, but many months and sometimes even years in advance. So if your goal is to conceive in 2025 or 2026, now is the right time to start preparing, and we'll talk about why that is and what you can do to start preparing. I'll just give a quick intro about why we even started Ferta in the beginning, sharing my personal journey, and then we'll dive into the actual meat of the content. So my story goes back like way when I was in my teens. I used to be overweight, but very into sports and athletic. And then I decided to lose a bunch of weight in high school because I wanted to look skinny. And I got to the extreme. So I started to work out a lot, run, but I was not eating enough, and I lost my period. I went to gynecologist after 9 months of not having a period, and they told me to go back. So they told me to go on birth control when I was 14. I didn't know what birth control was, but I took the pills and I got a period. So I thought it fixed the problem. And I didn't really question it because I was just busy with school and life and everything else. And I kept taking it every year, and I was getting a period, quote unquote, every month. And then I met my husband, Alexander, who's our other co-host, and told me to go back on. He told me to go off of birth control because he had done a lot of research and he's been in the health and fitness space for over a decade by that point, and fundamentally was skeptical about birth control and felt that stopping the natural process of the reproduction for a woman, where basically birth control just injects synthetic hormones into the body. So your natural hormonal cycle is completely stopped because of birth control. He just felt like that was not a good thing to do long term. So then I went off of it. And then I didn't get a period back again. And I was just busy working. So I kind of ignored the fact that I didn't have a period. 1 year passed, 2 year passed, and I started to get nervous. And I was just visiting gynecologists to see like they can help me. And every single one told me to go back on birth control because their justification was it's not good to not have a period, which is true, it's not good. But they were just looking at it from like treating that symptom of not having a period, which is birth control. So like gynecologists and conventional doctors are typically trained to treat symptoms and not necessarily look at the root cause. So they weren't really telling me why I wasn't getting my period. They were just telling me like what I could do to get my period back using allopathic drugs. And I didn't want to go back on birth control. So then I was just searching for solutions. And then I stopped working to take a break and figure out like what's going on with my health. And that's when actually all of my symptoms came raging back. So to have like anxiety and depression and like skin issues for the first time in my life. I was just not feeling motivated. It was just like strange. I didn't feel like myself at all. And I think the stress of working just kept my body in this, like, I was just operating on stress hormones. But once I stopped working and took a break, that's when my body was starting to actually heal and all these symptoms were starting to show up. Still no period. And then I was in Thailand in 2020, went to gynecologist there, and they told me the same thing, to go back on birth control. And that's when I was like, okay, I've had enough. I started to just learn about holistic medicine, functional medicine. This was not really that popular back in 2020. And now holistic medicine is very well known. People know about it. But in 2020, not many people were talking about it. I just found out about it through blogs that I was reading. And then long story short, sought out a functional doctor, hoping that maybe she can help me figure out how to get my period back. And she did a bunch of blood tests and she told me for the first time what I had, which was called hypothalamic amenorrhea, where basically the hypothalamus is not communicating with my ovaries to produce hormones that I need to have a period because it was under so much stress and it was just focused on survival. So it shut down that axis. Once I had the diagnosis, it became very evident how to fix my issue and how to solve it. And I went down many rabbit holes reading about hypothalamic amenorrhea and reading about just female reproductive health, how to heal it holistically. 6 months later, I got my period back, and then me and my husband conceived naturally 2 kids after that. And in this journey, we both just realized that one, conventional medicine just completely fails to help men and women who are struggling with infertility from a holistic perspective. They mostly focus on either giving allopathic medicines or referring them to IVF or some kind of mechanistic solution like that. But what we realized is that if you're healthy, you're most likely fertile. So like, we fundamentally came to the conclusion that infertility is no different than like metabolic diseases like diabetes or hypertension or heart disease, etc. The same root causes that lead to metabolic disorders also lead to infertility. So if we can help people heal those root causes, they not only become healthier, but they become more fertile. And that's why we started Ferta. And so I'll pause there and we'll jump into the content and we'll allow the rest of the team to contribute to the conversation. Alexander, do you want to start with some of the questions that we have?
That was really good, baby.
Okay.
Yeah, so actually, Anu, do you want to start off? Anu is our gynecologist. She's our doctor we want to introduce.
Yeah.
And I want her to take the lead on some of these questions.
Yeah, sure. So as Preeti began sharing, I think people should. So ideally, what I tell patients or couples is to plan for their pregnancy like they're planning for their wedding. In India, weddings are huge, right? So there's so much planning and so much effort that goes into it. Now you have destination weddings. They go to the location to see if everything is perfect, and that's what they want to do. You pick your photographer, you test him out, or you pick your clothes, and then you want to get into that, fit into it, and you want to work with your skin, so many things. And they put in so much of time and energy and effort into planning something so important in their life. But when it comes to conception and pregnancy, they seem to not put in the same kind of effort. So ideally, I would say you should plan for your pregnancy like you're planning for your wedding. Spend at least a year, I would say, for your conception and pregnancy. Why? Right? So when you look at the science and when you look at the normal follicular maturation, so basically a follicle is your egg sac, okay? So it has the oocyte in it, and then it has these cells that surround the oocyte, which is called granulosa cells. And these cells, the granulosa cells basically, are your helper cells and feeder cells. So they nourish the egg within the follicle, and they also respond to certain hormonal signals. Okay, so every month when you ovulate and the dominant follicle is released, it comes from a primordial follicle, which is the earliest stage of your follicle. And this primordial follicle is recruited to be released a year in advance. What's happening is the journey from your primordial follicle, pre-antral follicle, what we call, which is pre-antral. I'm sorry if this is a little too technical, but it means that it comes to the edge of the ovary, and that's your pre-antral follicle. Okay, so the journey from a primordial follicle to a pre-antral follicle actually takes roughly about 120 days. Okay, which is great. This is your window of opportunity. This is where we want to focus on making this particular egg cell that is going to be ovulated much later, put it in the right kind of environment, equip it with the right nutrition, with the right support, and give it the best, because that particular cell is what's going to become your baby, potentially, right? So that's why it takes that long, and that's why you need to optimize your overall health in this time so that you can have the best possible outcome. Another important thing is that, so basically this egg cell that I was talking about, it has the highest amount of mitochondrial DNA as compared to any other cell in your body. Why is that? Because everything that the egg has to go through, all the processes that it has to go through, ovulation, then it has to undergo fertilization, then it has to undergo implantation, and then there's embryogenesis, right? All these things are very energetically very expensive processes. And your mitochondria is your powerhouse of the cell. That's what's producing the energy. As we age, our mitochondrial function kind of declines. Okay, so anything and everything we do to support mitochondrial health will preserve your fertility for a longer period of time. Essentially, that's what we're doing. Other important thing that the egg cell will do, what you should remember, is that it does something called DNA repair. Okay, so once it is fertilized, the sperm which enters the oocyte and then it forms the embryo, it immediately has to repair certain damages that the sperm might have caused, or this sperm DNA is not normal. Your egg can actually repair that, and it can only do this if your mitochondria are healthy, because that again takes energy. So all of these things, you want to optimize your fertility, you want to optimize the cellular health on that level so that you can have the best possible outcome. Yeah, I suppose that's why you should plan it well in advance.
And then from the male side.
Yeah. So from the male side, it doesn't take that much time. It usually takes about 3 months for the sperm to be produced. But again, it's the same thing. You want to optimize overall health. You want to reduce. So we were talking about DNA repair, right? So what is the thing that leads to DNA damage in either the egg or the sperm? One of the most common things is your diet, your inflammatory diet, inflammatory oils, eating too much of processed food with AGEs, which is advanced glycation end products. Diet, very crucial. This is what is causing DNA damage. Apart from this, it could be too much stress. It could be oxidative stress from over-exercising for some people, right? So that, or the kind of lifestyle that people are living today, working with their laptops on their lap, the heat, and not giving the adequate recovery. All of these things can cause a lot of DNA damage, right? So you want to optimize all of these things. You want to optimize overall health to, again, even for sperm to be healthy. Certain supplements we might want to give. You want to look at nutritional deficiencies and correct those. So the best thing to do if you're planning a pregnancy, say next year, would be to go to a specialist, go to a holistic doctor, look and see what's missing, what needs to be corrected, correct your lifestyle, yeah, and do all these things so that you can have the best possible outcome.
That's a common misconception that many men have, where there's this idea that because obviously as a man you can ejaculate every day, there's this assumption that sperm sort of just get made in 24 hours. And in reality, like the sperm cycle of going from like the primordial germ cell that starts as sperm, fully mature sperm, it takes about 2 to 2.5 to 3 months. So if you're in poor health, now today, your future seed in 2.5 months from now is also going to be unhealthy. So even for men, you're still looking at about at least like a 3 to 6 month time period to fully get yourself metabolically fit if you want to maximize your virility.
Yeah, I totally agree. And like going on to the next topic, like, I think a lot of people struggle to know or understand what are the markers or signs to look out for to know whether your body is fertile or infertile. So, Anu, like, what are some of the either blood markers or just general health symptoms that someone should gauge to know where they are on this journey?
I think, as I was saying, I think overall health definitely matters. But when it comes to particularly what you're talking about, fertility markers, I would say let's start with menstrual health, right? Menstruation, in terms of menstruation, you want to look at if the cycle length, the duration, is it consistent? Okay, the normal cycle can vary from 21 to 35 days for any woman. But is it consistently coming at that time? Even if it's a 35-day cycle, are you getting it every 35 days? That's what we want to see. You want to look and see bleeding, how many days that is happening. Is it too much? Is it too little? Because if it's too much, you might be having fibroids or polyps or endometriosis, other things. If it's too little, it could indicate hormone imbalance. Okay. You also want to see ovulation indicators, right? The basal body temperatures, your cervical mucus, the consistency, what it should look like. Around the time of ovulation, it should look egg white and it should be sticky. Now, these things may not be so easily, people can't monitor it. Then you can always go for ovulation strips and look and see if you're ovulating. The best way to test out ovulation would be to do a day 21 progesterone if you're having a 28-day cycle. You also want to look and see if you have symptoms like PCOS or PMS, your premenstrual syndrome. If you're having a lot of struggle, too much pain, breast tenderness, mood swings, all of these things can indicate hormone imbalances, right? So that's about menstrual health. Moving on, you want to see metabolic health markers. What are we talking about? Insulin resistance and obesity, so common. And sugar dysregulation, so blood sugars. You want to look and see if that's normal or not. Your BMI, right? So BMI could be either high or low, and you also have skinny fat. So it's more than BMI. Probably what's more important is looking at body composition and see if you have the right kind of body composition. We also want to see inflammatory markers. We can test things like CRP or HSCRP. Look and see if you're having some kind of chronic inflammation, which can again lead to oxidative stress and all the DNA damage, everything that we were discussing. Lipid profile, right? So having too much of triglycerides and very little HDL or high density lipoprotein will again lead to inflammation and your metabolic health. And this was very closely related, as Preeti was saying, to your fertility and overall health. Now, the other things would be your hormone balance indicators, right? So estradiol, if you have estradiol imbalance, either dominance or too little estrogen, you can have bleeding irregularities, could have spotting at unpredictable times. You want to look and see the day 21 progesterone, as I was saying, which will indicate ovulation. We also look and see common hormone markers that we look at commonly for a female would be your FSH, your AMH, prolactin. All of these hormone markers are quite important. When it comes to men, you want to see testosterone and probably do a semen analysis. These are probably the markers that blood markers and lab tests, apart from the common symptoms.
Okay, great. And like, you recommend, like, how do people go about tracking these markers? Can they do it at home? I guess some of it they can do it at home based on symptoms, and then the rest they would need to request their doctors, or how do they go about doing it?
So as I was saying, if you're noticing all of these imbalances, right, in terms of your symptoms, if you're noticing difficulty in losing weight, gut health issues, bloating, burping, constipation, if you're noticing menstrual irregularities, headaches, any symptoms that might be, you just go to a holistic physician so that we can. Why I'm saying you want to look at the overall pictures, because everything is interrelated. Your hormone cycles, your brain is impacting your thyroid, is impacting your adrenals, is impacting your gonads. So you really want to look and see if you're overall healthy. So the best way to go about it is to plan your pregnancy, go to a doctor, get these tests done, look at nutritional deficiencies, look at B12, vitamin D, all of these omegas deficiencies, and correct them. But if you're, in terms of tracking, I would say the basal body temps, I think that's not very consistent, but easily trackable at home. Your body temperature should rise by about 1 degree Fahrenheit after ovulation. And then, like I said, the cervical mucus thickening can predict ovulation. And then there are these blood tests, ultrasound, all of these things that we use to track. So these are things that you can do at home in terms of ovulation tracking. What you can't do at home is your ultrasound. That's where you'll need a doctor to order these labs. All your labs, your blood work is something that the doctor should order. Yeah, that's about it.
I agree. I think, like you said, like the menstrual cycle, the health of the menstrual cycle can be measured at home with basal body temperature. There are devices now that exist. I don't know if it's available in India, but in the US, there's things like Mira and Inito or Prove, where basically you can dip like a stick in your urine, and then it'll tell you your LH, FSH, estradiol, so that you know when you're ovulating and if they're in range and stuff. So it's a cool way to really get like accurate data on your cycle. So if you're like really trying to track, you can buy one of these. They're expensive. They're probably around $300 for the device, and then you need to buy the sticks every month. But honestly, like Anu said, the basal body temperature and cervical mucus are probably the free, inexpensive, accurate way to measure as well. And then the blood markers, yeah, definitely you would need a functional doctor to help you. And that's something that we do at Ferta, right? Basically help people figure out exactly what they want to measure, both men and women. Cool. So then next topic I want to talk about is common mistakes that couples make when trying to conceive. So Anu, maybe you can cover from the female perspective, and then Alexander can cover from like the male perspective of what are mistakes that men make when trying to conceive.
So when we talk about couples, I'm sure Alexander will cover the male part, but the most common thing is actually ignoring the male partner's contribution to it. Because when you look at statistics, 50% of infertility is actually caused because of the male factor only, where the female is absolutely fine, but it's just the male factor infertility. Okay, the other things would be waiting for too long to get tested, right? To go seek help. So if you're under the age of 35 and you've been trying for a year, go get a checkup. Yeah, if you've not gotten pregnant in a year. If you're over the age of 35, then don't wait for a year, go within 6 months to get yourself tested. But ideally, what we are actually suggesting is come to a doctor even before you plan. That's the best way to go about it. What are the other misconceptions? I'd say over-exercising or being overly sedentary. These are, again, common mistakes that people make. Ignoring environment and the toxin load and the kind of lifestyle we're living, the kind of food you're eating, or how you're storing your food, and how you're cooking your food. All of these things are, again, common mistakes that couples make. Another big thing I would say would be neglecting your mental and emotional health. Okay, very important when you're planning a pregnancy. Too many people are dealing with too much of psychological and physical stress, even the psychological stress which manifests physically in your body. You really want to address that. If need be, therapy, other kind of stress management techniques could be whatever is your restoration practice. It could be meditation, yoga, whatever it is that you practice. Yeah, I think these, according to me, would be the common mistakes.
Yeah. What about for men, Alexander?
Yeah, from the male side, probably this is the most common fallacy men have, like I said, is they don't know what their fertility, virility status actually is. Because the assumption is if you can sustain an erection, you can ejaculate, that you must be fertile, you must have super swimmers, and it's just not the case. Male sperm counts have declined by over 55% since 1970 globally. In any country in the world, your average sperm count is basically half of what it was 60 years ago, on average. You could have low sperm count, or you could have poor sperm health, or both, and you don't know it. And you don't realize it until you are finally married and you're trying to conceive, and maybe 6 months go by, 7 months, and the assumption is always that it's like the woman's problem, it's the wife's fault. She's a barren woman. And then you go and get tested, and at the time it's like, oh, actually, you're the problem, you're the man, and you just didn't know. And for men, because men are, obviously men are more stress resilient, the assumption is often that if you physically feel okay, that everything's fine. That's not. Sperm are very lifestyle, heat, diet sensitive. Sperm are very fragile. Like we were saying earlier, the sperm process of getting them takes about 2 to 2.5 months. So over that 2 to 2.5 month time span, if you are, let's just say you're stressed out and you're not that healthy, but you're maybe your normal body weight, your normal BMI, but you have a high stress job, you have high stress lifestyle, and you don't know that you have poor S or sperm, or maybe you don't know that you have damaged sperm. And then you go and get tested, like I said, and it's like, okay, what do I need to do to change this? You're looking at about 3 months of radically changing your lifestyle, lowering oxidative stress, improving micronutrient density in your diet. And then 3 months from now, like full 3 months from now, then you'll have healthier sperm outcome, healthier ejaculate. But it's going to take time. That's like, right, those are all like some of the biggest mistakes. And also, like, a lot of men are just very unaware of their wife's health, and the wife's unaware of her health. So I was asked this the other day at a party with some friends, like, it's the best time to have sex. Is like the day of ovulation, is it days before? And this, I mean, it seems very basic. Like, if she's ovulating, just go, yeah, like you can have sex every day. Like, of course, right? Sex multiple times a day. But in terms of like, increasing your sperm density on any given day, the day of, like 1 or 2 days prior, like that's great to do. Obviously, like basically every other day, that's a good schedule. At the same time, if you're trying to, you'll encounter this with couples like in the fertility world. If you're a couple and you're trying to have sex as much as possible, that sounds great in theory, but also this creates a lot of stress because then you have to plan your day, your life around that, which is fun when you're 20. When you're 28 and working, or you actually have responsibilities, it's not so practical. At the same time, for men, like the more you ejaculate, the lighter the load is in each subsequent ejaculation. This is a real thing. If you haven't had sex for a few days and you ejaculate, and let's say your sperm count is 90 million, awesome. If you want to have sex again that day, now it's 45 million. You want to have sex a third time, now you're down to 10 million, and now you're basically subfertile. So every other day, like that's what you want. And at the same time, as I said, you want to coordinate that with your wife's actual day of ovulation, which a lot of women just don't actually track. They'll track like their menstrual cycle, like when they're bleeding, but they don't necessarily know when they ovulate. A lot of women are just completely disconnected from their body. They can't tell. Like they couldn't really tell you. They're not sure. You'd want to really encourage your wife to get her health in order and make her environment as stress-free as possible. A happy, healthy, fed, well-rested women are fertile women. Wife is stressed out, like you are not doing her, you are doing her a disservice with her fertility health. And if you look at the statistics for conception, in any given month, your wife only ovulates, a woman only ovulates one time. So you have like 1 in 4 chance of her getting pregnant that month. And then each month after that, it basically just resets. You always have a 1 in 4 chance. But a pregnancy, let's say you guys have sex, she conceives at that time, but she has a spontaneous abortion like 6 weeks later. Maybe her period's late. And you don't know that that happened. She doesn't even know that happens. Pregnancy maintaining itself is also very dependent upon her stress levels, her nutrition status, her lifestyle. You want to have the whole environment of the relationship stable enough and energizing enough where that pregnancy is going to stick. It's very possible she could get pregnant maybe multiple times, but maybe you keep having multiple spontaneous abortions, or you have a miscarriage of 12 weeks. It's like, well, what's happening? A lot of that very often is stress related. Maybe it is because of the males. Maybe your sperm count, you need to get a closer look. Maybe you have a DNA damaged sperm. A healthy marriage, healthy relationship is what creates the grounds for a healthy pregnancy. And like that is something, the men, that you need to take that lead and take that seriously. It's always nice to think that it's just going to happen. My wife came from a family of a bunch of kids. She must be fertile. It's just going to happen. But then it doesn't. And now you actually have to be proactive about it.
Awesome. That was good. I want to move to a topic around why it's important to, like we started, like why do we want to address the root cause of infertility rather than just treating symptoms like conventional medicine does? I know obviously your background, you started in conventional medicine as a gynecologist. So I would love to hear your perspective on the conventional approach versus the root cause approach that we take.
Yeah, so conventional medicine, we're usually just addressing symptoms, right? What that does is it's great. It's great for any acute condition. Anything acute you want, if you have pain, I will give you pain relief. If you need surgery, allopathy, the best. Hands down, modern medicine has conquered so many things that, which would have been a dream earlier. But modern medicine fails to address root cause. So one thing, what it does is you're giving temporary relief in conventional medicine, and you're not treating the underlying issue, which can persist and it can even worsen. So what does this mean? Let's take an example, right? You have a headache and I give you pain relief and the headache goes away. But what is causing the headache is never looked at. It could be dehydration, it could be hormone imbalance, it could be migraines. migraine, one of the most common reasons for migraine is mitochondrial dysfunction, right? So what that does is you become dependent on this pain relief, and every time you get a headache, you take the medicine, and your pain goes away. But whatever led to you having that headache, if it is dehydration, if it goes unaddressed, if it is underlying mitochondrial dysfunction, if that goes unaddressed, those things will still go on and create other problems, not just headaches. After a certain point, it evolves and it causes other problems. Another thing that happens is that conventional medicine, for example, what you were saying is that it can lead to misdiagnosis and delayed diagnosis, right? So you have hormone imbalance, you come to me because you don't have a period, and I just give you oral contraceptive pills, and okay, you need to get a period. It's not okay to not have a period. But if we looked at it from a holistic point of view, we would have diagnosed your overall health, looked at every other system, what's happening in every other system, and we would have probably gotten to the diagnosis of hypothalamic amenorrhea much earlier, right? Delayed diagnosis, misdiagnosis is an issue with just addressing symptoms. So you're missing, when you address only symptoms, I think we're missing the holistic approach itself, right? When we address root causes are usually quite manageable. Things like insulin resistance, obesity, these are manageable. If we address those, then we enhance an individual's overall health. So it's not just the symptom, you're actually improving the overall well-being of this individual. And if you're addressing only symptoms and doing the quick fixes, then you're missing the opportunity of making the individual healthy. Yeah, I think those are
Yeah,
the
that was a good answer. It made me think that like root cause approach in the long run is probably going to cost you a lot less money for hospital bills than
absolutely.
just treating symptoms, right? Because if you just treat symptoms, you're just gonna it's just
That's
gonna
what's happening with IVF, right? We're just treating the symptom. We're just putting you through expensive procedures without addressing the root cause. And then, yes, IVF can get you pregnant. I believe IVF is great. But then when we don't address the root cause of infertility, then you can have so many complications during pregnancy and childbirth. So
yeah.
you can prevent all of those things by taking care of the root cause.
Yeah, exactly. Because mother's health, it doesn't actually address why the mother's not able to get pregnant and she's in a suboptimal state from a health perspective. And then obviously the health of the mother impacts the health of the baby. So the baby could be less healthy. Whereas if you fix the mother's health, then she could have a healthier baby.
Absolutely.
Yeah. Awesome. So I think we've covered like 35 minutes of discussion. So I want to open up the floor to questions. We'll start from the very beginning. If you ask any specific doctor or physician that we should look for, I think this was related to seeking out help for figuring out how to measure your fertility and stuff. Yes, we believe in holistic medicine, integrative medicine. So anyone who's going to take a root cause approach, it could be a functional doctor, they could be call themselves an integrative doctor. There's different names for it. But like I said, someone who's looking at it from a root cause approach, that's what we do at Ferta, for example. Anu takes a root cause approach. And
in regards to specific accreditation, though, that's what, like, I think that probably would answer the question.
Yeah, I don't know. How would you answer that?
Yeah, well, so when you're looking for a physician, obviously there's lots of different kinds of specialists. A functional medicine doctor in the United States, there is a functional medicine college, which essentially certifies all functional medicine doctors in the US and globally. So if they say they're like a functional medicine physician, like that would be a good choice. A doctor like Anu, where they're trained in lifestyle medicine, and they emphasize that specifically, like I take like a lifestyle medicine approach, that you could look for as well. And oftentimes they're one the same. In regards to a doctor being an MD or a DO, that doesn't make any difference. That's just basically, doctors went to the doctor of osteopathic school, some went the MD route. It doesn't tell you anything necessarily about their personal philosophy. But functional medicine doctor, lifestyle medicine doctor, some doctors, they advertise themselves as a holistic physician, but you still want to look at what their actual accreditation is. Like, what does that mean exactly? But the standpoint of taking like an integrative approach or root cause approach, you'll just have to dig deep a little bit into their actual philosophy, which hopefully they advertise that on their website. You have to actually have a talk with them as well. Like, you have to go and almost interview the doctor. If you had these kinds of issues presented to you in a patient, like, what would kind of your approach to figuring them out? And that will tell you a lot, that conversation.
Yeah. Next question is, can you talk more about diet and supplements? What are the best foods and supplements beyond what's commonly known? Yeah, beyond what's commonly known, I think honestly, if you follow what's commonly known, you're like 80% of the way there. For example, eating a diet that's low in PUFAs, low inflammatory diet, basically.
That's not commonly known.
Yeah, I don't know what
I wouldn't,
commonly known.
yeah, you have to define what's commonly known. The Ferta approach that we use with patients and clients, I would assume perhaps most of you have heard of macronutrients. You have protein, carbohydrates, and fat. Like that, I think is fairly basic. With fertility, with metabolic health, you want to focus on micronutrients. So it's not just macros, it's micros. So if you are familiar with the philosophy of like it fits your macros, that's very common in the fitness world. I would say for fertility, if it fits your micronutrients, that's what you want to look at. So specific to fertility itself, all of the common micronutrients, vitamins and minerals, vitamin A, vitamin B, vitamin C, vitamin D, vitamin E, you essentially want to be maxing out everything at once. You go to any specific micronutrient, whether it's A or B or C or D or E or K, like you can find research that shows a deficiency will have a negative impact on your ovulation or your sperm parameters. So you want to maximize everything all the time at once. A good app actually to track your micros, Chronometer. We don't have any sort of partnership with them, no affiliation, but I know in Chronometer, if you use them and you punch in your food, they'll tell you always what like the micros are for everything. They'll give you a pretty good estimate.
Yeah, also, I think, Alexander, we want to see at Ferta, we work as a team, right? We have our own functional nutritionist as well. So we really want to look and see many people these days have a lot of food intolerances and they're not even aware. So I think, again, it's important to, in terms of diet, what is commonly known or not known. Many people aren't even aware that they have these allergies or subtle intolerances. So you really want to look and see and possibly work with a functional nutritionist is a good idea, I think. In general, I would say eat a balanced diet. So what does that mean? As Alexander was explaining, whole foods, lots of fruits and veggies, your good quality protein, good quality vegetables and fruits, which is organic produce. In terms of nutrients, I think for both partners, you want to supplement them probably with selenium and zinc. If not as in the form of capsules and tablets, then you want to give them selenium and zinc rich foods. Omega-3s, vitamin D, these are things I think we would commonly supplement them with, right?
CoQ10.
CoQ10, yes. And for women, I think folate, definitely, about 400 micrograms, very important if you're trying to get pregnant. Ideally,
And
about 6 months before pregnancy.
If you're vegetarian, definitely a B complex, methylated B complex.
Yes, yes. Sorry, I cut off Alexander. Please go on.
Oh, no. Yeah, no, that's a good point. I mean, along with maximizing your nutrients in your diet, indigestion and gut disorder also leads to autoimmune disorder, which also leads to poor fertility health, early health, productive health. If you have poor digestive health, if you don't have like healthy stomach, you need to get that fixed before anything else. We've encountered that, obviously with some of the patients we have where they have very poor gut health. And before you start trying to optimize, you simply just need to have healthy enough organ function in general to be able to uptake nutrients. So if you have gut issues, that's probably your first priority. Nutrients that were mentioned like zinc, selenium, definitely want to max those out. Omega-3 fatty acid intake, especially for women, and men, is very critical. Most people are not consuming enough omega-3s. Their diets are very omega-6 dominant, which is very inflammatory. Seed oils, not just seed oils, but just overall all the fat sources. So changing the balance of fat that you ingest, that plays a big role. Carnitine, there are a few nutrients that are known to positively affect fertility. I actually have an established relationship. Carnitine being one of them, which is predominantly found in animal protein. Beef is probably the best source, or goat/mutton. Also, you could get some from chicken, some from eggs. The carnitine is also something you can supplement with. That one is pretty well known in the male fertility world medically, where if you give a man large doses of carnitine, ideally injections, but that's not necessarily practical, but you can take as an oral capsule. Carnitine can definitely help sperm parameters a lot, and also ovulation as well. So, there's like
glutathione and NAC are also very important, I think, as antioxidants.
Yeah, as antioxidants. Yeah, you want to have your stress levels low, not completely zero. Like you do need some amount of healthy stress, obviously, but for women especially, you want a very low stress environment. Yeah, and even for men as well. Yeah, if you are living like a low sleep lifestyle with sporadic eating and maybe you're intermittent fasting, try to manage your weight, that's probably not having a positive effect on your sperm health at all. But again, like go get checked, go get tested. and then see what your baseline is and how you can improve it.
Yeah. Next question is by Bart. He says, how did you get a regular cycle after not having your period for a long time? So for me specifically, I had something called hypothalamic amenorrhea, which, like I said, it basically means that your hypothalamus is in your brain. It communicates with your ovaries to produce the hormones you need to be able to ovulate each month. My hypothalamus was not doing that. So my HPA axis was dysfunctional, basically. It was because of chronic stress. That stress came from under eating, exercising, and not sleeping enough, and just working basically 24/7. So basically, in my case, it was simple in the sense that I just had to reduce stress. So that meant I had to sleep minimum 7 hours a night. I increased my caloric intake and nutrient intake a lot. So nowadays, I consume between 22 to 2,500 calories a day because I'm pretty active. And as a woman, we are much more affected by stress than men are per se, especially physical stress. So women that are active, they have to be very careful about their nutrition and diet and make sure they're eating enough. In my case, I was not eating enough. So increasing my calories and nutrient intake and then not doing too much hit stuff. I still went for a lot of walks and did yoga and dance, but I didn't like do crazy hit stuff. I would just burn my adrenals out. So I cut all of that out, and then 6 months later, my body finally felt safe enough to have a period.
Well,
So
you also hypersaturate with nutrients for that entire time. That was the other factor.
yeah, I mentioned that, nutrients.
Yeah.
Yeah, so I was eating mostly animal proteins, things like beef, chicken, fish. I would have one of those every day, along with lots of milk and bone broth. Just trying to find the
raw
most
milk.
nutrient dense foods I can get into my body because for 15 years, I was basically nutrient depleted. So I had to like really push the lever on the nutrients to make sure my body knew that it wasn't starving, essentially. Next question is, what do you think about supplementing progesterone? I know I'll let you answer that.
Yeah, many women unfortunately have luteal phase defect and they don't know it, right? It's not for everyone, I wouldn't say that. Everybody needs to supplement with progesterone, but if you are having those symptoms, what are the common indicators? Like if there's something called biochemical pregnancy, right? So their test turns positive, but then when they go for a scan, there's no sac, and then she has a period. That's called biochemical pregnancy. So you have a urine pregnancy test, but then when you go there, you don't have a sac. There's no embryo there. Or if you have spotting and bleeding in the second half of your menstrual cycle, or have irregular period, all of these things could indicate luteal phase defect. It can also be recurrent miscarriages. That's also very common in case of lack of progesterone. So I think certain cases, definitely medically, we do give progesterone in the second half of menstrual cycle. It's great. You go for a vaginal progesterone or oral.
Is this true, Anu? Like I was reading that I think progesterone supplementation is great, like you said, for certain people. But is it true that if someone is in a high stress state, meaning like their cortisol is already high, they supplement with progesterone, it could actually make it worse because progesterone is the precursor to cortisol? Is it better that they bring the stress down and then supplement, or you think it's fine that anyone can supplement with progesterone?
I think it's okay to supplement even if you're very stressed out, because essentially what's happening is it's not that the progesterone is the precursor of cortisol. What's happening is there's a cortisol steal, right? So all that fat, the healthy cholesterol, you need cholesterol to make your steroid hormones, and your sex hormones are basically steroid hormones. So when you're stressed out, your body needs to make that much more cortisol. So there isn't enough of a healthy fat left to make your progesterone. That's how you end up having progesterone deficiency. So if it's very low, if it's very deficient, it's okay to take progesterone alongside this thing. But ultimately, yes, you have to reduce your stress so that you don't have to keep supplementing and your body can make the progesterone.
Yeah, that's a really good point, Anu. That a metaphor like I've used with clients like in the past in regards to like how hormones work, and this is this is simplistic, but I think it makes sense to people. So like you said, like you have cholesterol, and cholesterol is a precursor like to everything. Like all basically sex hormones are some version of cholesterol that then gets converted with like aromatization process and like a Some molecules get added, some molecules get cleaved off. If you have like low supply of hormonal fuel, so to speak, of cholesterol, that's just going to go to wherever your body needs the most, which maybe it's cortisol because you're in a high stress state. Similarly, let's say for men who like want to increase their like testosterone levels, for example, like testosterone can be converted into estrogen. But we wouldn't tell a guy like, no, you don't want high testosterone. Like, it's going to lead to higher estrogen levels, which will be bad. It's like, no, like you need testosterone first to function as a man, and then some percentage of that should convert into estrogen to keep yourself balanced. So it's not as if like you supplement with one that like automatically way imbalances the other. These things are always going to go in a roundabout, and it really comes down to that core source of really what's nutritionally driven of like, what's your diet? Are you eating enough cholesterol? Is your body making enough in the first place? And then that's how you determine your hormonal status. Because they all interact with each other.
Yeah, agree. Next question. How can someone kickstart their ovulation again after giving birth but still nursing? Are there any recommendations on spacing out pregnancies? That's a good question. I think every woman I've talked to is so different in this regard. Like someone would get their period 6 months after giving birth. I've had friends that haven't gotten it 2.5 years postpartum because they're breastfeeding. I think there's no right or wrong answer here. Just let your body ovulate when it's ready to ovulate. If you're nursing more than a couple times a day and you're not ovulating, that's totally normal. Once you wean, most people ovulate within like 2 to 3 months after weaning, breastfeeding. And in terms of spacing out pregnancies, you can correct me if I'm wrong, but my take on it is like minimum 2-year gap, but that's if you're like super conscious about replenishing your nutrient and mineral stores after the pregnancy. Most people need a 3-year gap because they breastfeed, and breastfeeding is very depleting to the mother. And
also is pregnancy.
So is pregnancy. So if you're breastfeeding for a year, for example, a year and a half, you're depleted. And so you need to spend 6 months after that to replenish yourself, and then you consider getting pregnant. I mean, you might be able to get pregnant before, but you're going to start from a depleted state, which could lead to other complications. The spacing is just dependent on how hard you want to work to replenish your body and how long you're breastfeeding for. There's a lot of factors there.
Also, don't take your body to the depleted state. I think when you're breastfeeding, also focus on nutrition.
Nutrition, yeah, super important.
Very important.
People worry. Yeah, it's normal for women to get conscious about weight when they're breastfeeding, but most women hold on to 10, 15 pounds when they're breastfeeding, and then they lose it like that once they stop. So I wouldn't worry about weight as much as making sure that you're getting enough nutrients when you're breastfeeding.
Yeah, and I was going to say some women, let's say they give birth, they're breastfeeding. Some women really want to lose like the baby weight fast, which sometimes breastfeeding will take it off, sometimes not. Like sometimes it's hard to lose the weight. You have to keep in mind if you are breastfeeding, like trying to like cut a bunch of body fat at the same time that you're trying to feed your child. Those are two completely opposing goals, obviously. You're gonna want to give that time at least 6 months. When you do go to lose the weight, again, like diet, nutrition for women, everything, you want to be eating as healthy as possible, as nutrient richly as possible all the time. Especially if you want to have multiple kids, let's say like fairly close together. If you want 5 children, okay, even if you're getting pregnant every other year, like you got to be eating right all the time. Also, the other factor, exercise. So each pregnancy is going to suck out some of the minerals from your bones. Some women, they end up like with lower bone density in pregnancy, and they don't necessarily realize it. But you want to be replenishing your bone density, which means you also want to be doing resistance training. So like getting yourself back into the gym around the 12-week mark and starting off slow, but get yourself physically fit and stay physically fit. Yeah, obviously, you worked out through both pregnancies and you work out all the time, so it wasn't an issue for you. But I know for a lot of women, they have the one baby and then they just let their bodies go. So then you end up like you're not breastfeeding more, but now you're overweight, you got mommy weight, your body's no longer toned, muscle strength is poor, and now you have this big uphill battle to try to get yourself back into like fit shape to hopefully maybe get pregnant again, and you just create more work for yourself. Which this is really a lifestyle factor. Like you want to maintain a healthy lifestyle regardless of what your state of fertility is, regardless of whether you're breastfeeding or not breastfeeding or pregnant or not. Like healthy lifestyle is a constant.
Also, can I just say one thing is that, in the interest of ovulating or having your next child pretty quickly, please don't not breastfeed your child. It's the most important thing. As functional doctor, everything that we've read up, it's so crucial to give 6 months of exclusive breastfeeding. And here in India, what we're seeing is that people are struggling to breastfeed. Like there's no milk. And then we're giving them all sorts of supplementation and everything. And there's so much of formula feeding happening in India, which is so unheard of like a couple of decades ago, right? You really want to optimize your health. Again, another reason to do that prior to your pregnancy and delivery is that you get adequate breast milk for your child. And it's so important for the fetal gut microbiome, for everything. Breastfeeding is very important.
Yeah, definitely agree. Next question is by Melinda. She says, is seed cycling good/recommended? If yes, can it be done while trying to conceive?
Absolutely, right. Seed cycling is great. There's quite a bit of research around this. If you look it up right now, there's some websites or some articles will say there's no evidence for it. But recently, the most recent lifestyle medicine conference that I attended just last year, someone had presented a paper on it. So you need a minimum of 15 grams of seeds every single day for it to show an impact. It actually showed to reduce your body fat, your thickness of body fat that you might be carrying in your belly, abdomen area. It helps to regularize your hormone levels. So all those 4 seeds, your flax, your pumpkin, your sesame, and your sunflower seeds, right? So seed cycling is great for, and no side effects, so go for it.
The only thing is obviously making sure that you're preparing the seeds properly, like soaking them and roasting them, not just eating them raw, because then you're not going to absorb the nutrients as well. How would someone know if they are causing stress/problems by over-exercising? You'll know. You'll not.
Menstrual cycle regularity or irregularity.
Yeah. How regular is your menstrual cycle? Also, how are your energy levels throughout the day? Are you feeling tired, or do you have the energy to do the things you want to do? Do you have like good mood, energy? If all of these are off, then you know you're over-exercising or under-eating. Oftentimes people think they're over-exercising, but really sometimes they're under-eating and under-recovering. So bump up your calories and sleep and see if that helps you feel better if you have these symptoms.
But don't you think, Preeti, some people are so out of sync with their bodies that they don't know? All these things that you just mentioned, the fatigue, the moodiness and all of that, they don't really notice it because we're so disconnected with our bodies sometimes. Sometimes I think because we're seeing those patients, right? We're seeing people who over-exercise, who enjoy the exercise. So probably one way to, if you want to go for blood tests, then we have to look at inflammatory markers. And like you said, I think it's very important. I agree with you that you will be able to tell, but you should be in sync and connected to yourself and your body to be able to observe.
If you want more like blood markers, usually people who over-exercise have low thyroid, from what I know, and then low T3 and T4, free T3, and then they'll have high cortisol levels, high inflammation, and low hormones in general. So low LH, FSH, estradiol, all of those will be dialed down because your body's not making enough hormones. So if you want like blood markers, those are the ones to look at.
For women, this comes from the exercise science or like the fitness world. This is very common. It's called the female athlete triage or triage, where female athletes, so like women who are very physically fit, they're doing lots of exercise, like a competitive sport athlete of some kind. They typically will have amenorrhea, so they won't have a period, have like low body weight, and they'll have some form of like osteoporosis and a higher probability of ACL injuries. And why does that happen? Because they exercise essentially too much to maintain a normal menstrual cycle, and they don't eat enough. And that might seem like a very niche problem, but if you are a woman who's very physically fit and you work out a lot, and maybe you have an orthorexic eating lifestyle, which is Preethi's problem, you could be experiencing that, where your issue is you're going to have to exercise a bit less, at least less intensely, and you will have to eat a lot more. For a lot of women who, that's very much like a type A personality problem. If you are the type of personality where you really thrive on stress and pushing yourself, and you can handle being tired, and you have that take charge, I can push through, that's great. Hand clap. That's not doing anything positive for your family at all. And sometimes those women don't really realize this until they want to go to have a child, and then maybe they have a menstrual cycle, but they're not getting pregnant. It's like they try not getting pregnant. It's like it's because you don't have enough caloric hormonal energy to actually sustain a pregnancy. You might just have enough to squeak out a menstrual cycle, actually ovulate, but it's not going to stick. You'll keep having a miscarriage, or you'll maybe have a chemical pregnancy. You're not getting pregnant, right? And then like, am I infertile? Maybe you're not infertile, but you need to dial down the activity and stress a bit, and you need to dial up nutrition and take a break for the rest of your life.
Agreed. What about methylfolate? Should vitamin D be paired with K2 or just sun? Methylfolate is great, especially for women, fertility. We typically recommend vitamin D for everyone because everyone's absorption rate from sunlight and stuff is different depending on your skin color, where in the world you live, how much sunlight you're getting a day. And since vitamin D is so crucial, we typically recommend supplementing and getting in the sun. Like getting in the sun, great, but supplementing is also a good insurance policy.
Yeah, you want to take D with K. So like vitamin K, it helps your body transport the D to your bones and your teeth versus it like sitting in the blood. It like goes together. Vitamin D status, like it is good to get tested. Basically, like the way it works with vitamin D, the darker you are, the more likely you are to be vitamin D deficient. If you're Irish and you get like 5 minutes of sun, you're probably fine. Like the lighter skinned you are, the more adapted your body is to producing vitamin D from not much sun exposure. If you're very dark, if you're black, if you're like South Indian and you're really darker skin tone, you're going to need a lot more sunlight to get the same amount of vitamin D. And some people just don't get that level of sunlight regardless. It's not going to happen if they're outside in the sun with their shirt off for 2 hours, right? So in that case, just take vitamin D daily.
Yeah. One question is asking, answer this, but maybe they want more specific foods. But he's asking, what would you include in an ideal preconception diet plus workout routine?
Sign up for Ferta, and we will get you set up with that.
It's not simple. Yeah. It's complicated.
I mean, it's everything we just talked about. Yeah, it's an animal-based diet. It's maximizing the nutrients in that diet, which some of it's just going to be eating animal fats, it's going to be eating animal proteins, it's going to be full-fat dairy. It's going to be some mix of carbohydrates, some vegetables for fiber, fruits that are in season. And you can get specific with the fruits, obviously. You can get very specific with all of it. Workout-wise, your body fat percentage is going to play a role, like your BMI. If you're a man, you need to lose body fat. If you have too much visceral fat, you're going to be doing some combination of cardio, probably 3 to 4 times a week. Zone 2, zone 3, maybe higher intensity, depending upon your schedule. You're going to want muscle mass. That could be anywhere from 2, 3 to 5 times a week lifting. Application of that is very detailed. The general recommendations are healthy diet, lift weights, get your heart rate up a couple times a week, be a healthy body weight. If you do those things, you're probably 80% of the way there. If you want to get into specifics, work with Ferta.
Yeah.
I don't know anything. I don't know anything about your health status right now, so I can't even tell you specificities.
Exactly. So I think functional integrative lifestyle medicine, these are all very personalized prescriptions, right?
Yes.
Yeah, you can't really give a blanket diet that's good for everyone. You really want to look at each individual separately.
And the last question is David. He says, to what extent does metabolic health affect sex organ sensitivity?
Being physically fit definitely affects blood flow. There's various research on this, like women who are healthy body weight, who exercise at least 3 or 4 times a week, they have better vaginal blood flow, they have better clitoral blood flow, they have better orgasms, they have easier delivery, they have healthier pregnancies. So if I mean this blunt, like if you are physically fit and hot, you're probably going to have a better sex life. So be hot. That's simple.
Okay. I think that was the last question. Appreciate everyone joining us today. We will definitely send a recording and a transcript as well as a summary of this session in the next 1 to 2 days max, once we process everything. But yeah, we'll also share a link. If you want to work with us, we'll share a link on how you can do that, or just learn more if you're interested in learning more. But yeah, we appreciate you joining, and we'll host more of these soon. So thank you.
Awesome. Thank you guys for showing up, and we will follow up with you through email.
Bye, everyone.
Thank you. Bye-bye.